Welcome to Zim Papers Television Network for this very, very special discussion on sexual and reproductive health and rights in the era of COVID-19. Today I've got two special guests, and of course we are exercising social distancing, and I had somebody in the studio last week telling me this is not social distancing. What it is, in fact, is physical distancing, but we still continue with our social interactions. I'd like to welcome you to the studio, and I'll start with the lady. I want you to introduce yourselves a bit, where you're from and what you do and why you're passionate about the issues we're going to be talking about today.
Okay, thank you very much. My name is Martha Mlambo. I'm the projects officer at Zimbabwe Women's Resource Center Network. As an organization, we are more into women empowerment, and we do that through information provision, through networking, and also what we call strategic advocacy, where we interact with different duty bearers to make sure that they avail resources or whatever is needed for the day-to-day running of people's lives. Why I am here today is we are so passionate about women, and sexual and reproductive health rights have always been on the sidelines. So we've tried to push for that. We've tried to educate women, and we've also tried to interface with even the relevant ministries on how best women can be afforded good sexual and reproductive health rights. But you find that it seems as if we're always failing due to resources. Mainly the major problem is resources. So that's why we are here, because we want to continue talking about it until we get a solution to the problem, because it's a problem.
Absolutely, and I will ask you this as we go on. I want you to ponder it at the moment. If you're forgotten at a time when all things are fair, what are you going to do when all things are not fair, when we've got COVID-19? And that's one of the things that we're really going to be talking about, because you're forgotten when things are perfect, as it were, in the perfect world. And in an imperfect world, things tend to get a little bit dodgier. I'll move on to the gentleman.
Thank you, Robert. My name is Raymond Majambe. I'm with Sexual Reproductive Health and Rights Africa Trust. It's a regional organization that works with adolescents and young adults to improve sexual reproductive health and rights. So we are also working to promote access to SRHR services, to ensure that there's also youth-friendly services for the young people, especially adolescents and young adults. So in terms of my motivation of working on this area is that I believe in a system where everyone must be given equal opportunities, especially when we talk about sexual reproductive health and rights. So I foresee a society that respects and values the rights and freedoms of women and men. So basically, this is my passion. Absolutely,
and we are, after all, sons of our mothers. Now, we will also have a live call with Dr. Ruth Labode, who, if you remember, chairs the Health and Childcare Portfolio Committee in Parliament, and we've been having her. I've been having her on a number of our shows. She's a very passionate woman, and you shall hear the passion as she speaks. We're also going to be having you, and please be interactive. Talk to us. Tell us what you think as we go on and on in the program. I've already had Lorraine Muya here in Loveness Chavunduka Rwodzi joining us amongst a myriad of other people all over the world who are joining us to talk and discuss with regards this very, very pertinent issue. Now, thanks also to our sponsors, the Southern African Parliamentary Support Trust, HIVOS, Women for Leadership. Right. Now, according to the UNFPA, good sexual and reproductive health is a state of complete physical, mental and social well-being in all matters relating to the reproductive system. It implies that people are able to have a satisfying and safe sex life, the capability to reproduce, and the freedom to decide if, when and how often to do so. Now, the concept of unmet needs for family planning defines the gap between the women's reproductive intentions and their contraceptive behavior. Now, Zimbabwean women over the years have been failing to access family planning due to various barriers such as costs, accessibility, religious and traditional beliefs, among other factors. The dilemma has been further worsened by the lockdown enforced countrywide due to the COVID-19 pandemic. Now, the lockdown further posed a huge barrier to women in accessing family planning, and many women, both married and unmarried, do not use any contraceptive method, although they want to avoid pregnancy. Now, studies have shown that reducing levels of unmet need can reduce maternal morbidity and mortality by reducing the number of unintended pregnancies, the number of abortions, and the proportion of births at high risk, according to the UNFPA. Now, these are issues that we've been talking about here on ZTN time and again. We even had a talk we had on abortion, we had a talk on menstrual health management, and these are some things that we're going to touch on as well, because we've also got, we had a chance to speak to a woman in Bulawayo who is actually on quarantine because she's COVID-19 positive, and people have been giving her a lot of assistance in the community, but everybody forgot her menstrual pads. So that's something absolutely important. But going back to 2006, for example, the unmet need for family planning was added to the 5th Millennium Development Goal as an indicator for tracking progress on improving maternal health. So that's something that's absolutely important. So back to the question I asked you. If women do not get that assistance, do not have it easy when all things are equal, how are we going to have this fight fought at a time like this, in the age of lockdown?
No, it's going to be very difficult, and it will continue to be more difficult. Because like right now, as you've just highlighted, this woman is somebody that's getting assistance from neighbors, from maybe like local authorities that are around her, because they know of her situation. How about a woman who hasn't like contracted the disease and nobody is even talking about her? You find that women are continuing to be on the sidelines, as I said earlier on, because one, especially when we talk about menstrual health, the issue of accessing sanitary wear, right now it's mostly you get them from big supermarkets, the OKs, the TMs and the spas that are open. And for somebody to go there and buy, it's very expensive. It's a bit different. When things were equal and we didn't have the lockdown and all shops, you know, we had so many options. You could choose to either go to a tuck shop or to wait for somebody who's going to South Africa and just directly import and you buy from them. But now they are so, I mean, it's now limited to a few very expensive shops. So you find that it's now a very difficult thing for many women. That's number one. Then number two, when we talk about social sex delivery, there is challenge of water. In most, especially in high-density suburbs. I'm not so sure about in low-density suburbs, because maybe those ones who say they can afford to have a borehole or something like that. But when you're talking about the ordinary woman or the woman at the grassroots level, they are failing to get water, the basic need, just to get water. So when you are having your period, you need to constantly be washing. You also need to make sure that you're clean, just yourself. Or if you're going to be using those reusable that they're always talking about, because some say I use reusable pads, but what will you use to wash them with when there's no water? When you've got maybe to walk maybe about 5 kilometers or maybe 3 kilometers, even 3 kilometers now to get the water and back, and you're bleeding. You know, when we're talking about menstrual period, it's a very serious thing, but it's a very important for us women, because if you don't have your menstrual period, you cannot be defined as a woman.
And indeed, you talk about something very important with regards access in this period, because you say it's something that is pertinent at the center of your womanhood. It's very important for you as a woman, but there's a big problem, isn't there, about a mindset shift that needs to happen, because how are you going to get onto a bus and you don't have a letter and you want to go and buy, for example, or just get access to your family planning tablets, for example, or your pads? Is the police person or whosoever is at the point, are they going to understand that this is really that important for you?
Actually, we actually have got some reports that women are actually being turned away from police stations. They've actually gone out there to try and access those letters, to say, you know what, I am on a loop. I'm actually on, you know, UDI, the ones, you know, the 5-term plan. Yeah. but that one is not available at the local clinics. So for somebody to get that, they have to travel, for example, to major hospitals like Parerenya, especially in Harare. You have got to go to Parerenya, or you have got to go to Harare Hospital. So if you're coming from, say, Budiriro, and you don't have a letter that gives you, so that you can be able to show the roadblocks, that means you just go without the contraceptive. And one thing about contraceptive, you cannot just jump from one to another as if you're taking painkillers. That today you're taking paracetamol, tomorrow you decide maybe to take Panadol. You know, if you're using a certain type, it's maybe because that is what your body reacts to better. Yeah. Because sometimes if you just take any type of contraceptive, you might react negatively, or you might end up having some bad negative effects. So now the challenge is that women are failing to even get on the bus and to get to where they're supposed to get the contraceptive. If it's that 3 months injection, they cannot go to Parerenya to get that. Then number two, for the few that are, when there was no lockdown, people used to get, I don't know how, but people used to buy from tuck shops. For those who are on the pew, they would just go to the tuck shop and they would buy. It was because of it was readily available. It was cheaper. But now you only be able to access those pills from pharmacies and a few pharmacies that are open. And most pharmacies, by the way, are charging in US dollars. And if you ask them how much it would cost in our local currency, they will tell you a ridiculous price. So even now, when you're asked to pay to get, if you need 2 packets, you have to pay $1, $1 US. So an ordinary woman, where are they going to get that $1 US when they are failing to get the local currency? To make matters worse, I don't know what's happening, because just a few days ago, I just noticed that the council has been going around demolishing tuck shops, market stores in the residential areas. And you find that is where the women who used to get, to get the money that they would take to the pharmacy to buy these contraceptive methods. But now they don't have any source of income. So other than just poverty, like what to put on the table, they are now faced with this challenge of where to get the money to even buy contraceptive methods. And
I want to give it to you that even if somebody's body doesn't react to a certain regimen or regime, it's all about choice as well, because somebody has a choice to determine what they want to use. Do I want to use a tampon? Do I want to use a pad? Do I want to use the butterfly cup, and so on and so forth? But also, Raymond, I'm coming to you especially from a position of informing. Yeah. How did we get to a point where issues to do with sexual and reproductive health and rights, which are actually at the epicenter of our understanding as humanity and our reproduction as humanity, to think that these are flimsy issues? And I also put it to you that not only are we talking on the issues of women, which are actually at the heart of and really at the bottom of this food chain, but just last week we ran a story when we were talking about how the people wanted access in quarantine to condoms, and a lot of people thought that should be belittled, and that was a gutter press story, and it's absolutely ridiculous how we seem to think SRHR is not important, and when you report on it, it's gutter press. When you report on menstrual health, it's flimsy, it's gutter press. Where did we get to this? How did we get to this ridiculous point?
Thank you, Robert. I think it's really a challenge if we look at the kind of issues that continue to come up on a daily basis, which end up, sort of like hiding some other issues. I think if you look at the COVID-19 situation, it has really taken a toll on many of the things in our country and across the globe, so which has resulted in the sidelining of some of the SRHR issues. But I think it is important that we need to realize that SRHR is at the core of everything, because when we talk about the demographic dividend, we are looking at ensuring that we are saving our countries, we are saving the world from having a demographic disaster. So we are saying that it is very important to ensure that you know, we put it at the core of our programming, we put it at the core of even the government deliberations, because as it stands, we are looking at, I remember the UNFPA recently gave a report saying that you know, we are looking at 47 million women who are going to have lack of access to contraceptives. We are looking at 7 million unintended pregnancies that are going to come from this situation. So I believe that it's an issue that we need to bring up and ensure that our duty bearers, our policymakers, you know, our different actors are at the core of pushing this, because we don't want to experience a demographic disaster.
Absolutely. And which is why people should look at, especially when we talk about family planning and contraceptive methods, that these things complement each other and not replace each other. And that's why it's important to have both men and women having access to SRHR related instruments like the pill, instruments like, of course, condoms, if they will. And funny enough, we seem to belittle that. But as you kind of alluded to, sex is a very wonderful thing, because it's really at the epicenter of us as a people and personalities. But there are other things, as has been alluded, that define womanhood. Now, when we went to Bulawayo, we had the privilege of speaking to COVID patient number 21. And while she was getting access to a lot of other things, she wasn't getting access to menstrual health management tools, if you will. Now, very soon, straight after this, we're going to listen to what she will tell us. And I want us all four to follow, because right now we've got on the phone Dr. Ruth Labode, who is the chairperson of the Parliamentary Portfolio Committee on Health and Childcare. And we want to listen to the story of COVID patient 21 and her needs and what she's doing at the moment to plug in, as it were, that gap and her lack of access to menstrual health management wear. And we'll have that discussion straight after we listen to COVID patient number 21.
There's some few things that we need. We'll call a few individuals to come and assist. And some of the things we're now cutting off because, honestly, we cannot be crying for everything.
I'm speaking from a public health perspective, and there are certain things, for example, some necessities like sanitary wear, menstrual wear, and kit like that. Those are very intimate things, but those are things that you cannot not ask for. How are you dealing with things like sanitary wear?
For now, honestly, we don't have those, and no one has actually thought of that area, and it is indeed a difficult thing to ask. We're using the old ways of trying to handle ourselves. It is difficult. I think it's more painful now. It is the more pain than the coronavirus itself. The social pain is more than the virus itself. But we're just hoping when it's over, maybe we'll restore our dignity.
Everything else, but we do know it's really at the core and at the center of her as a woman. Now, I've got Dr. Ruth Labode on the line. Dr. Labode, if you can hear me, welcome to the program and thank you for joining us. First of all, what would you say, as the chairperson of the Parliamentary Portfolio Committee, needs to be done to help, especially women and who are a disadvantaged demographic, to have access in this time of COVID to SRHR, including especially family planning methods and, of course, sanitary pads for their menstrual health management?
Thank you very much, listeners. My concern with the whole lockdown strategy, which I, by the way, support, was it was very poorly planned. And it was poorly planned because it was an emergency. We all acknowledge that. But we should have taken into account our own situation rather than following what our neighbors were doing. We should have considered that we have almost 90% unemployment. Our economy is dependent on vendors and the small to medium scale entrepreneurs, which are women mostly, who are trying to survive through selling tomatoes and other things. So on announcing and giving people about 3 to 4 days that there's going to be lockdown, you only be allowed to get 5 kilometers away from your house and travel. And yet we know in a situation that our country, especially in Bulawayo, most of these pharmacies are in town, which means, and then there were roadblocks set up to ensure that people coming from residential areas don't come into the city, unless they belong to essential services. This meant that if you were remaining with 5 tablets from your contraceptive pills, you were in trouble. And if you then were passed through that police roadblock, you either had to bribe or even compensate, whatever. The policemen were now in business. That's exactly what happened. And then this meant also women were just if they had a little bit of money, because of the poverty that had come, contraceptives became the last thing on their mind. I think a lot of women just prayed and said, even sanitary wear, if you go to some of the areas, you could not find it. The prices shot up 3-4 times higher. Even those who could access it could not access it. The current situation of also having youth, female girls just languishing around because the lockdown is you are locked not to go to the city. But you are not locked to roam around your own location that if you stay in Zimbabwe. You can roam around, you can jump on my fence, go next door to a boy comes to your house, you are safe, no condom, nothing, and then you just hope nothing goes wrong.
Now, Dr. Labode, just to cut you short there, you sit as the chairperson of the Parliamentary Portfolio Committee on Health and Childcare. What have you done as the chairperson and as our representative going out there to make sure that this has been rolled back within the lockdown, that this is addressed by the powers that be within lockdown, because that is surely your mandate that we gave you as the electorate, is it not?
Yeah, it is my mandate, but I'm sure you also know that Parliament is in lockdown. Be that may be, not as the chair of the committee, not on behalf of the committee, I've been talking to the ministry, telling them that we should have actually, even now it's not late, we can do it. Going to people like population services Zimbabwe, borrowed their mobile clinic, because now they are in lockdown. And the one in Harare, one in Bulawayo, because these are 2 major cities. They could do a day, today you're in Zimbabwe, but tomorrow you're in Kwazana, offering these services, contraceptives, ARV management, all these issues, in one stop with a bus. That could have been done. I mentioned it to them. I mentioned to Dr. Matsima when he was still at the Ministry of Health, and that's all I could do. I'm not an implementer. I'm an advisor. And that's what.
And you were saying there is that attitude of that we went into lockdown and we were not considering issues of menstrual health management, and we were not considering issues of family planning, and a lot of people said, sizabona lo. Where does this mentality come from, do you think? Where do you think or why do you think we disregard issues to do with sexual and reproductive health management, and how can we improve that as a society?
SRHR services have always been ignored, not a priority, simply because you don't die immediately like malaria. So it has always been an issue that needed a lot of advocates pushing, almost sometimes that is something which belongs to civil society as organizations. Right now we are aware that there's a lot of gender-based violence because we have locked women with abusive men. In abusive relationships, they have nowhere to report. If you are in a lockdown, where do you report? How do you cross the roadblocks that says you can't go to the next police station to report? So we have tended not to take SRH issues serious. But I think we went into a panic. We were worried about COVID and the number of people it would kill. And we forgot about everything. It was only when now we're locked down, we started realizing. I told them, I said, look for mobile clinics. Mobile cars, 2 of them only. They can cover this area. They just do a day. In a day, they do 2 western suburbs. We would have actually stopped this. My fear, actually, post-COVID, we are going to find ourselves with very high mortality from unsafe abortion. We have a lot of teenage pregnancies. We have women, married women who are unwanted pregnancies. That's exactly what we're doing.
We've also got, Dr. Labode, we've also now got this impending problem that we may have, as you mentioned right in your last statement, that we will have a lot of unwanted pregnancies, especially in this period, and that may mean either a boom, a baby boom, but on the other hand, it may also mean a lot of backyard abortions, illegal abortions that shall impact on our maternal mortality rates. Indeed, this is a problem that we're supposed to look out for. What will you recommend after lockdown so that we make sure that we minimize the impact of these unwanted pregnancies that, granted, we're certainly going to get after this COVID-19 lockdown?
After COVID-19, one of my concerns is we are going to have some of the diseases we have gotten rid of, ailments like marasmus and kwashiorkor, nutritional things. A lot of children are starving in some of these during this lockdown because the mothers can't afford to give them anything. So we are going to have hospitals full of children who need food. And then we are now going to be having mothers who are pregnant, not knowing how they are going to feed their children. So if you ask me, that we should be looking for a similar package of some kind for women, especially who are in the SME sector, to ensure that we economically empower them. Because this is where the problem is going to be. Those who get pregnant, look, we don't have a law, we cannot say, let's then give them the pill I was reading somewhere which was distributed in America. Women we actually asked to say, through mobile clinics, if you miss your period, this pill can be given to you. This pill will be flushed out, whatever is unwanted, within a month. But now we are going into our second month. If you got pregnant in March, in the next 2 months or so, you are not eligible for abortion even in those countries where abortion is legal.
Absolutely, absolutely. Now, Dr. Labode, I'll have to cut you short there because we need to now discuss what you spoke about here in the studio. And as always, I'm going to be coming back to you as this well of intelligence and knowledge with regards to these issues, because this is, granted, something we really are going to be talking about as the months go by, because we certainly don't know when lockdown will end. Thank you so much for joining us from Bulawayo, I presume you are in, and it's always a pleasure to have you.
Thank you.
Now that was Dr. Labode. You heard how passionate she was about her issues, how knowledgeable she was about her issues, but she also gave us a very scary scenario, as it were, that we are going to be having issues like unwanted pregnancies, an escalation in abortions, and how are you prepared, for example, speaking to the youth as you do in SRHR for these discussions, because they are going to come?
Thank you, Robert. I think for us as SRHR Africa Trust, we have looked at the different options that are available, considering that we have a lockdown and there is limitation in terms of movement. So we are now working on social media platforms. Like, for instance, we have developed a YouthWise page on Facebook, which is an interactive platform that disseminates information on sexual reproductive health and rights, because we realize that there is a big gap in terms of the knowledge around sexual reproductive health and rights. And many young people don't have the agency to make informed decisions when it comes to their sexuality. So for us, we have created this platform to ensure that we are reaching out to the different young people, and we're also harnessing the community radio stations to ensure that we reach out even to those who don't have access to social media platforms. And also we've made a partnership with Population Services Zimbabwe, where we are actually promoting access to services, like in the specific areas where Population Services Zimbabwe is operating in, and also to support that in the areas where PSZ is not available, we've managed to get bikers who are going to be supporting with delivery. So what happens is with our platform that we have developed on YouthWise, we actually have shared a flyer that informs young people on the services, where they can get the services, and if they can make call-ins as well. So we've been receiving quite a number of phone calls, which we then make use of through our referral system, where we get our bikers to then deliver these contraceptives that may be needed during this period. And I must say a great thanks to our funders, like the Swiss agency and the CEDA, who are also supporting us with funds to ensure that we reach out to these marginalized communities with the right information, with the correct services to these communities.
Certainly. And I also want to think you had quite a very bad morning this morning when you woke up to the new data prices, because that means some of these efforts that we're trying to reach out to the people have been impaired by the astronomical rise in data costs. But hopefully we'll, as usual, get used to it, and hopefully we'll keep reaching the communities. And your organization, what are you doing to gear up for this this influx of problems that we've just been? There's a cocktail of problems that we've been given by Dr. Labode to expect, a plague of sorts. And it's a real and coming danger. What would you do to mitigate that?
Okay. As an organization, what we have been doing and what we will continue doing is that we don't work in a vacuum. We always work with women in the communities. They will help us to cascade the information. So we have what we call champions. We have what we call community monitoring monitors, who are just on the ground, and because they know the health needs of their locals, of the people that they live around. So we continue to give them information, and we've created like WhatsApp groups where we continually share information. And we also actually been using what we call edutainment, where we partner with theater groups, local theater groups, that they then perform something that is educational, and then we then send that those kids to our different constituencies, so that they also learn. Because we've discovered that some people cannot read, some people cannot write, but when they just view a drama or watch a drama, they are able to learn from it. That's what we've been doing. And what we've also been doing is, as an organization, we are also into what we call gender budget analysis. So we continue to do that at local level, where we look at the local budgets and what is it that has been allocated towards the health budget of the local authorities in the areas that we work with. So we look at that, and when we see the gaps, then we raise the gaps. I mean, we raise the issues with the responsible authorities to say, this is what we need when it comes to health service delivery in their areas. And we've also been partnering with the likes of Dr. Labode at that level, where we're actually also doing...
So you know her passion? So
I do.
You've seen her on fire?
I do,
okay,
yeah.
So
I've seen her on fire. As she said that, she's there to recommend, she's there to give ideas, and she cannot be the one to implement. I really support what she was saying, because sometimes it's also because of the resources.
Absolutely.
Because as much as she's passionate about it, sometimes the resources are restrictive.
Absolutely.
So as an organization, we've tried to also partner with the government being on the supply side, where we give them, like we point out that this is what we think should be done in terms of the health service delivery in different areas. Because like right now we're talking about COVID. Most rural clinics, some nurses are actually complaining that they don't have enough PPE. So because of that, if a patient comes in, they are not free or they're not comfortable to serve that client or patient, because they don't want to put themselves at risk. The other day I was reading about Mrewa nurses downing tools just because they didn't have enough to work with, tools to work with. Some of these things, are from both sides, where the nurses want to do the work, but they don't have they don't have the resources to do that.
Well, I will tell you this. The people you're reaching are also reaching out to us now. And we've got, for example, Dean Chiparoshe was saying, during this lockdown period, several institutions have moved from to online service delivery, especially in the education sector. I think it's high time our government adopts this system in the health sector so that no one is left behind, and to embrace technology. We've got Philip Muziri saying decentralization of services is also critical as a strategy. And Dean Chiparoshe says, well, this is probably a discussion within our discussion, exactly, because there are other areas which are so marginalized and they could hardly access SRH services way before this lockdown. Important that Plaxidis said way before, that thank you to the panelists for a relevant discussion. It is true for us women, we are unable to access birth control pills, such as the combined oral contraceptive pills. This will obviously result in unplanned pregnancies, that cocktail we were talking about. And Philip Muziri says COVID-19 has magnified a crisis in service delivery that has been simmering below the surface. And dare I read one more? True, SRHR, and that's Kuzaimo Wishim. True, SRH have always been marginalized and sidelined. They have never been prioritized even before COVID-19. And really summing up the sentiments we were talking about and what we were feeling with regards to this. And again, just for the people at home, just to thank HIVOS and the Southern African Parliamentary Support Trust for having us continue these discussions, especially at a time like this of lockdown, because while we are in lockdown, our problems are not lockdown, and menstrual health management as an issue is a very, very big crisis. I'm going to tell you a little story, but only after we get into menstrual health rights and management right now. Now, over the years, menstrual health management discourse has remained a very contentious subject, as thousands of women and girls have failed to enjoy their menstrual cycle due to various challenges. Girls and women from underprivileged households for years have failed to access sanitary wear due to its costs. Now, lack of information has also worsened their dilemma. Poor water and sanitation in Zimbabwe has also compounded their challenges. Now, with the coming of COVID-19 pandemic, which has seen lockdowns being enforced, this has worsened the plight of women and girls. Now, I've got a package that I'm going to play for you before I tell you my little story and the whole brouhaha, why I use the words like contentious. But let's first hear this about issues around around menstrual health management, rather.
Women and girls in Zimbabwe lack adequate facilities to manage menstruation. Imagine using cow dung, leaves, rags, papers due to lack of sanitary wear. Water challenges also worsen their plight. The lack of education on menstruation has seen boys and men lacking understanding of all these challenges, resulting in women being humiliated and victimized. Women and girls suffer in silence. In Zimbabwe, prices of sanitary wear are skyrocketing beyond the reach of many, forcing young girls to miss school during menstruation. Sexual reproductive health rights activists believe the solution lies in the provision of free sanitary wear.
are the issues, and that is the plight. Now, before we move into menstrual issues proper, I just want to read one more comment that really struck a chord with me, and that's again Dean Chiparauche, who I think has got a master's in this, or a PhD, bringing up very, very incisive issues here. He says, I think for the issue of unplanned pregnancies, the Termination of Pregnancy Act of 1977 needs to be reviewed as soon as possible, because it robs women and girls the choice of whether to keep the pregnancy or not, because it's restrictive on the pregnancy resultant from rape, incest or fetal impairment, or if it threatens the death of the mother. But in this lockdown era, lack of contraceptives will result in a number of pregnancies. They should have the choice of whether to keep it or not, but the TPA is absolutely restrictive, as Angie Carey comes and joins us and says, hello ZTN. Now this has been a cocktail of issues that we've also been discussing here at ZTN, because it seems one issue with regards SRHR impacts another. But now we were seeing that situation report that we're getting on menstrual health management. And contentious because it's a very, very natural process, I would like to think, because I've not gone through it, perhaps yet, but very, very natural process. But there was a campaign I was asked to be a part of when we were trying to sensitize people all in society and say, well, menstruation is absolutely perfectly normal. And we had to hold out up a pad with a simulation of blood on it. What it caused on social media, because it was supposed to be something to shock society into discussing something, people were more offended than really looking at the issues. But it actually at least got people talking, and for that period of time, there eventually was an avalanche of people responding and giving out pads, and we were also part of that. I was also part of that. But that's not a solution, is it? Because look at COVID-19 now. We cannot go to see these communities. We cannot go and donate. And this is an issue now of period poverty. Because if I'm poor and you keep coming to feed me through a soup kitchen every day, one day that's not going to be feasible. And COVID-19 has shown us that. What do we do? What do we do?
Yeah. I continue to say this. I think there is a challenge where as a country, we have continued to rely on donor funding, or on what you call civil society organizations to actually give these services. But if these services were actually given by the government and they were budgeted for in the national budget, in the local government budgets, you would find that, you know, it's easier for some, like right now, we have actually been doing some research to find out if people are able to walk from their homes to their local clinics. And some have actually said, you know, it's not that difficult. You can move from your home to your nearest local clinic. But the challenge is the resources. You get there, there's nothing. So the thing that we would want to advocate for is for the local clinics to have those things, instead of having of relying on civil society or on other donors or on handouts like what we are doing right now. Because the clinics are there, but they are empty. There's nothing. So that's the challenge. So what can we do to the national budget, to the local government budgets, to make sure that they've got enough resources that when this happens, they are able to respond in a manner that will actually save their closest communities. Yeah, that's what I think.
Absolutely. Now I want to go through these just as we try and pick our minds, because these are questions that are actually frequently asked questions now in the period of COVID. Some are asking, is contraception or family planning safe to use during the COVID-19 pandemic? Others are asking, I want to avoid getting pregnant during the COVID-19 pandemic. What can I do? I can't access my contraceptive method of choice. What do you advise? What is the best contraceptive method to use during the COVID-19 pandemic? I want to change my contraceptive method. Is it possible? I want to remove or replace my implant or IUD. Can I do this during COVID-19 pandemic? Why is providing contraception or family planning as well as family planning services and information important during the COVID-19 pandemic? And others are asking, if I'm a policymaker, what can I do to make sure people can access contraception and family planning information and services? So these are questions. You were talking about the IUD. Somebody thinks in the middle of COVID-19, in the middle of lockdown, they have to have that replaced. And yet you're being told essential services. And we do not seem to think that sexual and reproductive health rights are essential services. We're in a mess, are we not? You're in planning, somebody says, how then can I assist people, I assist my community in accessing SRHR services? And what would you do? What would you say? What's your method that you will use to give people access? Because information is one thing, but access is another.
Yeah, very true. Thank you very much, Robert. I think I would respond on two-pronged perspective, in the sense that I think one is an advocacy issue where we are looking at our security services. I think, you know, in the promulgation of these acts that are actually governing the lockdown, I think it's good to also expand and ensure that we give a leeway for women so that, you know, their issues are respected. I understand that SRHR was at some point added as part of the essential services, but I also think at the security services level, we need to ensure that there's flexibility of movement, that, you know, our women and girls have this kind of access. I also believe that in terms of accessing the services, as you have mentioned, it's good to ensure that we share the maps that are available in terms of where the services are. Like, for instance, for us, we have done a mapping of where the contraceptives are being shared. Like, for instance, I know Population Services Zimbabwe is actually conducting outreaches at this point. So I think that information needs to be shared within our different communities. Like, for us, we're actually using Facebook, we're actually using WhatsApp platforms, so that, because I understand some of these long-term contraceptive methods, they require, you know, a clinical aspect to it. So I believe that there is need to ensure that we share this kind of information where the services are, and also with our delivery model. It's good if they can also reach out to our Youthwise Facebook platform to ensure that they get to be referred to the actual services. And for us, we also help in terms of the delivery model that we are using.
What I also want to tell you is it's interesting you should mention your map and the fact that you've mapped things up. But I also want to bring you guys alive to the fact that starting yesterday, when there was a review of the lockdown and the type of restrictions, a lot of those places are now actually closed because their people have not yet been tested according to the new rules for the next 14 days. So that place that was open on in the past 2 lockdowns and the people could work now have to stop operating at least for a while until their people have been tested and only to resume services. So it's only getting a lot worse. But of course we couldn't go on and on and on, but perhaps I should speak about just one thing that's coming here. Dean Chiparoshe, the PhD gentleman I was telling you about, somebody responds to him and says, Dean Chiparoshe, no need to review that act. Zimbabwe is a Christian nation. Those things always come up. And Angie K saying, all girls that fall pregnant while in lockdown perhaps should be supported to continue in education under protection of schools. Girls are obvious victims because pregnancy is visible, the baby's father is protected. These things always come up. But as you can see, this is a discussion that we can go on and on and on about, because for as long as we're sexual people, we shall always have sexual problems that seek sexual solutions. But also, again, thanking HIVOS and the Southern African Parliamentary Support Trust for helping us have this discussion and bringing it to light. Just in parting, just 2 words that you would want to tell us to wrap this up, and then your 2 words, Raymond, before we call it a day.
Okay, from ZWRSN, we will say information is power, so let's continue sharing it, because, you know, when everything else is closed, information can always spread.
Absolutely.
Yeah.
Reaching out. We need to continue reaching out to ensure that we have improved access to the different vulnerable communities. Thank you.
Information is power, and reaching out, and that's what we do here on Zim Papers Television Network. We reach out to you every day and we give you information every day, and that information is flawless because Zim Papers Television Network, along with our partners including HIVOS and the Southern African Parliamentary Support Trust, will always go forward and forward and forward to make sure that you're in lockdown but your intellect is not, because we'll keep feeding you with information that's important. So from me, Robert Mukondiwa, and the entire team, have a great day.